good and evil. So these are two forces that we all wrestle with inside of ourselves and in the world around us. Today, I'm talking with Dr. Fred Schiffer. He is a Harvard psychiatrist, a researcher, and the founder of the Dual Brain Psychology Institute. So he has discovered that we actually have two minds, one healthy and mature, and the other wounded and reactive. And when we understand that inner split, we begin to see where good and evil really take root and how we can choose which side to live from. Before we get started, I want to say thank you to our sponsors, Dr. Bradley Nelson and iHeartRadio, and just a huge shout out to our fans, our followers, our listeners. Thank you so much. Please do not forget to like and subscribe before you leave today. So it's really good to see you again, Fred.
Yes, nice to see you. Thank you.
I love today's topic. It's so interesting. Good and evil. So, from your perspective, where does the idea of good and evil actually come from?
Well, when we live in the world, we see some people who are destructive and uh, harm people without obvious cause or external cause, and generally we consider evil as acts that harm us or people who are in our group, and
Mm,
and uh, and we consider good usually people who um, um, help us and promote us, like you. Uh,
yeah.
uh, and um, and so that in some terms, it's kind of obvious what we would consider uh, good and evil, but there's also a certain perspective to it. In other words, uh, to uh, um, uh, Russians attacking Ukraine, uh, they can feel good about themselves. They're standing up for the motherland or fatherland or whatever land it is,
Yeah.
and and uh, uh, and people in Ukraine, however, see blowing up uh, apartment buildings and government buildings and infrastructure and trying to take over the country and who knows what fate is. Well, we know that they're going to damage people. They're going to torture people and rape people and if Ukraine falls to Russia, it's not it's going to be horrible for
Mm,
Ukraine. And so to Ukrainians, Russians are evil.
right.
How could they? But to Russians, Ukrainians are evil. They're
Right.
withholding Russian land, from Mother Russia, and they deserve what they're getting, and they should have surrendered, and so uh, so there's a certain sense of um, perspective that determines whether we see something as good or not good, and or evil, and I think that it has to do with how we define our group. So if our
Mm,
group is all the Russian people, then anyone within that sphere who helps Russian people is good, and anyone who
right.
attacks with drones or whatever is evil, and and uh, and the same with the Ukrainians. So the Russians are not in their group, and looks like the Americans are not in their group so much anymore. It's to be seen, but um, uh, and uh, but I think we define good and evil by what's harmful and what's helpful, and and where dual brain psychology comes in is that we may have two minds, and one of them may be traumatized and and not making good decisions, maybe trying to escape pain, and it can lead to an addiction, and oftentimes a person views that as evil, but a bad thing, and that. And the idea, if I go to an AA meeting and I say, "I'm Fred, I'm an alcoholic," it's supposed to make me feel good, but it often doesn't. That
Yeah, there's shame associated with it.
Yeah, exactly, and so I think that understanding that I'm an alcoholic for a reason, that I was humiliated and suffered uh, some unbearable pain, and the little boy in me decided, I feel a little better after I have a couple of beers,
Yeah.
and I forget that by the eighth beer I'm not feeling so good, and
Mm.
and so I lose sight of that. But that my intention is good, but my little boy is dominating my head, and so I'm making some bad choices. And if my mature side can be aroused, then um, I can not be so bothered by the early insults and feel better about myself, which is the source of the unbearable pain. And if I feel better about myself, I lose my appetite for the alcohol. And so I think that people can recover, not just go into recovery. And I think it depends on if I can understand my trauma and if I can work with the troubled side of myself and talk with it and help it. And so um, and one of the differences between uh, uh, a different war between different countries is that if Russia takes over Ukraine, uh, uh, there's that possibility. But if I'm having a struggle within my head, I can't get rid of one brain hemisphere, even if it's
Darn. Ugh. I wish it
so.
was so easy.
Well, it's not easy, but it tells me what I have to do. I can't
Yeah.
just get in a plane to Chicago and fix my problem. My brain comes with me, both
Yeah.
of them, and um, so so I have to learn how to focus on my trauma and learn more about it and help myself with it and help the little boy in me to appreciate himself and feel better. And
Well, before before we hit record, I was sharing with you that I went through an addiction and been sober for 10 years, but I'm still on that very low dose of Suboxone, which they use to treat opiate addiction, and it's the tiniest little dose, and it terrifies me the thought of getting off of it because of the withdrawal and all of that thought. So I would love for you to take me through that exercise. Let's show everybody what it looks like, both sides of the brain, and how this might help them.
yeah, cool. Okay. And getting off of 2 milligrams is not easy. So it's a low dose compared to 64, 34 milligrams, which, is a higher dose, so just two seems like a very low dose, but a lot of my patients really struggle to get off of 2 milligrams. So it's not easy. Uh, but what I was suggesting is last time we did kind of an eye covering uh, thing, and the idea is to again, I use my iPhone here, cover one eye and then move it over to look out half of one eye, and that
Okay.
stimulates the opposite brain. So, and in my so this would stimulate my right brain where the little boy lives in me, and so he's pretty well behaved now, and so I don't really feel a lot of pain over here, and he's pretty comfortable right now. Uh, but if I want to do some heavy work, or if I'm upset about something, I can go like this. And as soon as I feel like, no, I can handle this, and get a sense of clarity, that can help me and stay with me. So it's a really cool tool. Uh,
Very cool tool. Yeah, I mean, I saw it firsthand on the last episode. I was just blown away how incredibly powerful it is. It's so simple.
yeah, yeah. Well, what we're doing is we know from fMRI studies that I mentioned, um, that just going like this actually lights up the blood flow in my left brain by looking to my right.
Okay.
And that changes my personality. So it's not a drastic change, but that you might not notice it. But if I'm upset, like if I wake up in the middle of the night and I'm upset about something, it's usually the little boy who's up, and I'll go down and I'll talk to him, and I'll look out his side, and I can feel that pain a little more, and then I clarify what I'm upset about, and then I can talk to him about whether that's really true, and I can look out the other side and say, well, no, you look, I feel pretty good over here, and I can compare those two views, and it helps me to communicate and help that little boy in me. So that's what dual brain psychology is really about. And
Yes, fascinating.
so what I want you to do is to think about uh, cutting your dose uh,
Okay.
pretty dramatically, just sort of to stimulate
So
your.
it's gone. It's gone. Okay.
Yeah, and I want to know what you're feeling.
There's some fear surfacing. Definitely some fear surfacing.
Hmm. And there should be, because it's a horrible feeling. Yeah,
Withdrawal is a terrible, terrible feeling.
especially from buprenorphine, because it's a very the chemical buprenorphine attaches very strongly to the opioid receptor, and when it comes off, it just makes people feel lousy, and it's different from heroin withdrawal. There you get more diarrhea and sweats and stuff, and you look sick. And this is something that there's a pain that people experience that's not the same as heroin withdrawal, but it's compelling. And most of my patients they don't want to get off it, and will stay on it for years. And when they don't have an addiction issue anymore, just
Yeah,
to
it's been 10 years. It's been 10 years for me, and there's just this tiny little dose that I take, and it drives me nuts. And I'd love to see it out of my life, but it's controlling
okay.
the
So
fear.
you feel some of that pain now, and
Yes.
anxiety.
Oh
Okay.
yeah, totally.
Now, did you bring your equipment?
I got
Yeah. There you go. Okay.
it.
Uh, and So let's look at one side. And I don't remember which side felt better or worse. So, let's look at the worst side if you remember.
Yeah, this is the worst side.
Okay. So you're out of buprenorphine and you're starting to get withdrawal. Right? What are you feeling right now?
I feel like I could cry right now. Like I'm
Hmm.
actually having like a well up of emotion.
Hmm. Share with me.
So Tara, I feel like my body just flushed and it's like feels like it went into a cold sweat. Um, and my heart is racing and I'm scared. I feel terrified.
Okay. Okay. Well, let's not traumatize you here. Let's have you look
No,
at
I'm good. I'm good. I'm okay.
okay.
I'm just
Let's
being
look,
honest.
yeah, no, good. And let's try the other side. So look out
Okay.
the left half of your left eye.
This is an old plane ticket.
Yeah, yeah. Electric bills were well.
Wow. Okay.
Um, so so you're in withdrawal and you're out of Suboxone.
Now I feel at ease and calm. My heart rate is dropping. I'm back to my normal temperature. And I'm like, whatever. That's the word that's coming to my mind. Oh, well, like, I'll be okay.
Isn't that cool?
Wow.
Okay.
Yeah.
So now the other thing is, do it again. Put that thing up again. Okay. Now I want you to notice that you're okay. You can handle it. You say
Okay.
that, yeah, but mean it. Not because I told you, but do you feel
Oh,
that?
yeah. I can handle this.
Okay.
100% I can handle this.
Okay. Now when you put that down, that'll stay. Okay.
Mm.
And so you don't have to walk around all day with it stapled to your forehead. And we have sunglasses, special sunglasses that we're having manufactured that are lateralized and do the same thing as that. They actually look nice, and you can wear them all
Ah,
day. And
so yeah, because this would look pretty funny if I walked around all day like this.
very funny.
But
and,
wow, what an
and
impact. Like
you're bumping
I
into them.
literally almost started crying and then I went to just like bliss. I was like, whatever. I just felt so good.
Now, the other thing is, it's important, is that um, I'm fond of saying that I don't have any addicts in my practice or any alcoholics, and I don't. I have people who've been traumatized,
Right.
and with trauma, people do a lot of different things. Some people are lucky and they find the library, but most
Yeah,
people don't.
right.
And finding opioids is a solution to this pain. But it's not just any pain; it's the pain that you're feeling. In other words, when you were looking out your right eye, the right half of your right eye, you were feeling a lot of distress,
Yeah,
and 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 that distress, I think, if we explored it, it is going to relate to uh, difficult experiences that you had. And when you're welling up, it's like, oh no, you're going to have to be tortured again.
right.
And 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 that now the torture is going to be with Suboxone withdrawal, and
Right.
but it's reminding you of something that you need to work on.
Yeah,
Like, in other words, that and you need to look at it also with the other side to see that you can sit with the trauma more now and understand it and understand that you're not a heroin addict, uh,
yeah,
that you're a human being who was looking for a solution, uh, and that. that this trauma is very powerful, and if you had to live on the other side, it would be intolerable, and you can't
It
function.
would be intolerable. That's a
Yeah,
fact. You just illustrate that. Like that was I am a pretty chill person and like I'm very strong, but that made me feel like I could easily go just it made me want Suboxone. It was just like like I can't imagine. It was intense.
yeah, and so it is scary. Okay, and
It
also,
was, yeah.
so there are two things, and this is true of trauma, that the trauma is scary and difficult, but the consequences of the trauma are scary and difficult.
Right.
And is that side going to come back and dominate you and cause a relapse and because that's intolerable pain? But what you have to see is that's what you're dealing with, intolerable pain,
Mm.
and that's what this is all about. That
Right.
there's a really deep pain down there, and that you're welling up, and you were terrified. Your heart was going. Your pulse had increased, and so something really bad happened, and you need to have some compassion for yourself for that, and not be blaming yourself because it led to your making a bad choice. But children do that. Children are in a terrible place, and they might scream or run away, or and they don't know what they're doing, and that's sort of what happens when that little girl takes over, and she's desperate, and anything to quiet this, and but now we have a new way of quieting. It's just an electric bill, and we can quiet, and then we can talk to that little girl and explain that no, she's not a bad person, she's not evil,
Mm.
she's a good person, she's injured, and um, and I think that um, that if I think when people do criminal acts and are sadistic or abuse other people, I think that it's because they have trauma that comes out in that way, and there are
Right.
reasons why that, but they're repeating the sadism, and but they have to get control over it if they're going to not be an evil person.
Yeah.
And but with you, you're doing this is something that's self-harm and harms your life, but you're not being sadistic, and you're not trying to uh, go to school and shoot children
Yeah,
with
I'm
shot.
not stealing my neighbor's milk and cheese out of their fridge at night.
I do that, but no, no. uh,
Yes.
uh,
How interesting. I have a question though. So, do you think that some people can be born evil or good, or is
I,
this fully just the way we're shaped when we're growing up, or do you think
I
someone can be
think
born
that
that way?
Yeah, my experiences, I don't know everybody, and I haven't met everybody in the world, and we're through
You
history,
haven't?
the sheltered life. uh, but uh, but I can say that of all the people I've met and worked with as a psychiatrist, I have never met an evil person. I've met a few people who've done some things that I would say are reprehensible,
Right,
and but we have been able to understand why, and to repair that, so that they don't continue it, and they're able to understand why they did it, and deal with that, and that can be hard, and not everybody succeeds at that,
right.
but I think that that's the cause for. uh, sort of our common sense of evil. The people who
Mm.
are sadistic and selfish um, uh, so I think but again, I think it's in a very interesting way. A lot of it comes back to the dual brain psychology, in that I mentioned before we went on the air. I have a patient who suffered a lot of sadism from a parent, and he gets very angry and can be attacking, and we have to work on his trauma, and sometimes he comes in and he's very very pleasant, and or if I give him a light treatment, it can make him very pleasant, but the other side is very strong, because the stronger the trauma, the more work you have to do, because the little girl, the little boy, keeps thinking, uh, but what if it happens again? But. And so he's always preparing for the catastrophe. And
That's
so,
exactly what I would say. I was thinking in that moment is like, oh my God, what if I run out of Suboxone? I don't want to feel that pain, right? That was the little girl in me being terrified of that feeling.
right, exactly.
Mm.
And I think that that feeling, I think, relates to an earlier feeling.
Yeah, that's likely the trauma I was using substances to not feel,
Yeah,
right?
yeah.
Yeah,
And there was something terrible that you were trying not to feel.
yeah,
Yeah. And that's
incredible.
that if you can uh, not run away from that, but discover that it was terrible, but you can bear it, that you're a grown woman now, and you're not a child, and horrible as it was, you can sit with it and you can grieve it, and you don't have to act on it.
Mm.
Um,
It's so
and
interesting to me because I'm a person that, and I know a lot of people out there can relate to this. I am a healer. I do somatic healing on myself. I work through, I talk about everything. I write to like get out feelings. I
yeah,
dance, I sing, I do yoga, I go to nature. But you just proved to me that that is so deeply ingrained in my body, yet I've been working on it for so many years.
yeah, yeah. But I think that if you are aware of what the ultimate trauma is, and then you use those techniques that you have, and knowing that you're using them to work through the trauma, they'll be more helpful.
Mm. See, for me, I don't really know if there was a catalyst. I mean, there was a lot of struggles, but I just started using substances and it felt good as an empath. So I can't pinpoint an exact moment of where
Well,
I was like, I don't need to feel anymore.
working
It
together.
for me, it was more of like, I feel so much in this world, I don't want to feel anything anymore. That's what I feel like it might have been.
But usually it's something painful, not
Okay.
just in the world, and a lot of times it's hidden. In other words, it might
Mm.
be a sister who was brilliant and got all the attention. So it doesn't have
Ah.
to be blood and guts, or
Well, I had a
molest.
brother who was brilliant and got all the attention. So there you go. You just called it.
Okay, well that may be, and then you can't complain about it, because then you're a jealous person, and
Right.
nobody wants to be jealous,
I'm
and
never going to be as good as him. That could be the little girl in me. Like, how am I ever going to, how my parents going to love me like
well,
that if
and I
I
think
can't
that,
be,
that one
yeah.
one of the things about that is how painful that is. That it
Yeah,
may
especially as
seem
a little
very
kid.
trivial. Yeah.
Hmm. So tell us about one of your patients that you worked with and how did working with them through these techniques that you used, how did it transform them? I'm sure you have a ton of stories. Do you have any really good ones that stick out?
In my book, uh, Goodbye Anxiety on Amazon, there are about 5 vignettes of psychotherapy sessions. I really and the book really explains the process, and I'll try and give you a quick run through. So first I try to take a good history and try and get a sense of where the pain's coming from. And then what happens is let's say that your brother was a trauma, and it's not a trauma that you could take to the DSM. They'll throw you out. Okay. Uh, but I consider it a trauma, and
Right.
and and maybe he was even embellishing it a bit, or again, I'm not there, but I'd have you kind of feel your way through that, and see if you can find that pain. But then it leads to you're going to school, and well, you're not going to do as good as him, so why try? And so you're not doing as well. And so he's brilliant and you're stupid. And I mean we're starting to get in intolerable land, and then as that develops, uh, and you feel more inadequate as time goes by, then you have to get out of Dodge quickly, and
Yeah.
opiates take that. It's a bus out of Dodge.
To bust out of Dodge. That's a fact. Yeah, you're bringing me back to my childhood.
Well, that's where you need to go.
Yeah,
And you got to go back to go forward.
right. Yeah. Do you find, like most or all traumas kind of based this way? It happens early on in life, or can someone develop like a serious, like I know the obvious, if someone witnesses like something scary, but do most things stem back from our childhoods?
In my experience is limited, as I say, and
Right,
most people. Now I see people with severe trauma, and with trauma that is in a parent, like what we're talking about with you, and it's severe, but it's not obvious. Whereas I have people who had crazy alcoholic fathers who were beating their mother, and they got thrown down the stairs, and mother got beaten up, and then there was a divorce, and there was all this chaos, and so that's not uncommon, and that would be a severe trauma. I had one patient who had a sadistic mother who did all kinds of tortures. That was unusual for a mother to torture a child, but the mother was, crazy, uh,
wow,
but the poor child really suffered, and so that was an obvious trauma that nobody else knew about because she didn't.
right.
Nobody knew what happened. That happened in the dark at home, and um, so there are serious traumas, but the traumas that I see uh, uh, um, pretty much always begin in childhood. Now, I have people who were traumatized in childhood who then go off to war or volunteer for become a firefighter or something,
Right,
and so they amplify their trauma and they create new traumas. And and you did that with your addiction, so that you were not only dumber than your brother, but now you're an addict.
right.
And what do we think of addicts? Oh,
Yeah,
and so it's kind of confirming the torture,
that makes
and
sense.
yeah, and makes us uh, shut this up. Sorry. Um, so and that torture as it grows and becomes more. When you say you're at a meeting or someplace, or you're thinking, "Oh, I'm an addict," that's horrible. Okay, that's really to be not as good as your brother. That's sort of who cares, but to be an addict, oh, but yet it's all related. It's the same thing. It just develops over time. And so is being an addict a trauma? You bet. It's a serious trauma. Uh, but my point is, where does it come from? And and
Mm,
and and had you had another situation where you were praised more and got more attention, then you would have done well in school and used your brilliant mind, and you would
right.
have and
I mean, I did really well, but not as good as him. So it was like the gold. He has gold and I'm silver. And it was always like this. He was just a little bit better. That was what it was like. So I really think you're onto something. You just blew my mind.
uh, but that little difference meant you were a failure.
That's
You
true.
So it's sort of maybe passing you needed 99, and you got 98,
Yeah. And he got 102 somehow.
Yeah, exactly. Yeah.
Oh
And-
man.
But, but then the feeling of being a failure is what kills you.
Yeah, it's true. And then that compounds because then you just make decisions later on to numb that. So
Right.
man, I bet
Because
you a lot of people are
if you're a
drawing
failure, I
some
mean,
parallels right now.
yeah, if you're a failure, that's intolerable. You can't function, and it's just too painful.
Well,
That
then it's like the workaholism and trying so hard and needing external validation. And now everything's piecing together in my mind of all the things that I went through before started healing. It makes so much sense.
Mhm. Yeah.
Hmm. Wow. So at the end of the day, what does your research teach us about the true nature of good and evil?
Uh, well, I think that again, I think it has to do with whether something is destructive to if something's destructive to me or to you. So we may have a different view of what's evil. In other words, there might be something that's benefiting you, but it's hurting me. And so I might consider it evil and you might consider it a good or vice versa. Uh,
Hmm.
but uh, but generally, most people are harmed by sadistic people, and sadistic people often uh, find other sadistic people, and for the Nazis, it was good. If you were an Aryan and you as long as you didn't uh, uh, fall out of favor, which was easy to do, you really benefited. You got wealth and you had good places to live and eat, and so for the Nazis, it was good, and it wasn't evil. They were just benefiting their group, and but if you were in England and they're getting bombed all the time and people are getting killed and they know that the Nazis want to invade and take over the country and enslave people, it doesn't look so good. That looks
Yeah.
and so again, if it's happening in one head, then we have a duty to try to get our healthier side, get our Churchill to win the war. And
Hmm.
but there is a difference between Churchill and Hitler, and and uh, and and Hitler probably I don't know his history that well, but probably suffered some significant trauma, and
Significant. I'm gonna bet on that myself.
yeah, And Churchill had trauma, but it was more bearable, and he had other support, uh, so I think that I think he came out a more of a good figure. Although there are a lot of things about him that are controversial, about his colonial endeavors and went early in his life, but in my mind, he's a good person, and I'm glad that he saved us from Hitler, which he did single-handedly.
Right. Amazing. Where can people find more out about you and your work and the books that you wrote?
Uh, so I have a website called dualbrainpsychology.com. And that's what I call my theory, dual brain psychology. And I particularly did want to call it dual brain psychiatry. I thought it was kind of, I didn't want to be associated with the medications and stuff
Mhm.
psychiatrists doing and the medicalization of it. I don't think diagnoses are helpful. I think all the diagnoses that we have are insults and harm people. And people come in injured from trauma, and then we give them another trauma. So, oh, you're
Yeah.
borderline.
Oh, you've
So,
got ADHD. Oh, it makes sense now. Yeah.
yeah,
Yeah, totally. I've had to unlearn that, I'm just Lisa. Like I'm not attached to anything, it's just me. And that was difficult as an addict because you go see your doctor and they're looking at your history and then they look up and they look at you a little differently.
I just took it away.
What's that?
You're not an addict anymore.
No,
No,
absolutely not.
you're a trauma victim. That's
Yes,
different. And trauma victim doesn't have that pain. It's that, anybody can be a trauma. The sky could fall on me tomorrow.
you're
We
right.
all, yeah. And so it doesn't hurt.
There's
It's
no
not,
division. There's no division.
yeah,
Like I see like addicts and then I see healthy people, but
right.
affected trauma person, everybody is.
Yeah, exactly. Everybody is. Yeah, yeah.
Mm.
And there are different degrees of it, but it's all the same. And certainly, if you have a mother who's actively devising tortures for you, I mean that's a very severe trauma and very difficult to get over, but possible. But uh, uh, but if you have a more ordinary trauma, most of the traumas I see are more like yours, and again in my book you'll see what some of the different traumas are, and they're things that you would expect in life.
Amazing. So we're going to link all of that in the show notes. And do you have any last minute thoughts on the topic today?
Uh, Not particularly, no. How do you
Okay.
feel?
I feel great. I feel almost like a sense of freedom that now I know what I need to do. Like it's like knowing that I can go in there and talk to the little girl and figure it out. It's
Mhm.
a feeling of hope and I'm a little shocked. Like I honestly didn't think I would react like that to it still because of all the work I do on myself every single day.
Right, right. And now you can focus it a little more, and it'll really help you more. So I'd keep
Yeah,
doing what you're doing, but just focus it on her.
yeah,
Mhm.
I will, and I'll report back. I'll
Yes. Okay.
update
Cool.
everybody next time we talk.
Great. Thank you.
Amazing. Thank you so much for being here again. Such fascinating work that you're doing and just such a help to the world. So like bless you. You're so amazing.
Thank you.
And to our audience, you guys are amazing too. Thank you so much for tuning in. And as I said before, please do not forget to like and subscribe. You just heard from Dr. Fisher, who has a podcast on our channel, and he will be back to dive deeper into his dual brain psychology. Until next time, take care, everybody.